This is a video to help you better understand your Aetna student insurance plan. There will be definitions and some graphics that may seem kind of confusing at first, so you may want to take notes or even replay the video. We know insurance can be confusing and complicated, but don't worry. Between the Student Health Center staff and this video will help you figure it out.
Let's say a student named Susie is having stomach pains and makes an appointment to see her provider at the Student Health Center. Before Aetna will help Susie pay her medical bills, Susie must pay a $250 deductible. A deductible is the money you pay out of your own pocket before your health insurance plan will pay. This is an annual fee. In addition to the $250 deductible, Susie must also pay 20% of her medical bills. This is called coinsurance. Coinsurance is when you share the cost of your medical bills with the insurance company. Aetna Student Health pays 80%. You pay 20% when seen outside the Student Health Center. In the year 2013, the deductible is $250 with a referral. If you do not see your provider for a referral, the deductible is $400. Now let's say a student named James is riding down College Avenue and gets hit by a car. Oh no! James now has a broken leg, concussion, and punctured lung. This all happens while his wife is on her way to the hospital, about to have a baby. Now this means you are both in the hospital. If you don't have insurance, the money you would pay out of pocket would be a very large amount. If James has never been seen outside the Student Health Center, that means he needs to meet his deductible. A deductible is the money you pay out of your own pocket before your health insurance plan will pay. This is an annual fee. In the year 2013, the deductible is $250 with a referral. If you do not see your provider for a referral, the deductible is $400. If you are seen by a provider outside the Student Health Center, you will have to pay a $250 deductible plus 20% of the total bill. James then needs to realize that after he pays the $250 deductible, then he will also need to pay 20% of whatever the bill is. The 20% is coinsurance. Coinsurance is when you share the cost with your insurance company. Aetna Student Health pays 80%, you pay 20%. If you're seen outside the Student Health Center, this is an example of what your bill may look like. This is the amount that you were charged, the $3,250, and you're only going to have to pay $600 because you're going to have to subtract your deductible from the $3,250, so you minus your $250 to get $3,000, and then you times that by 20%. So you have to pay $600 versus $2,650. Now after James is done with the ER, he needs to make an appointment to see his provider at the Student Health Center. His provider will refer him to see a specialist such as a physical therapist. Remember, if you are seen anywhere besides the Student Health Center, like the hospital or urgent care, you will get a bill in the mail. If you are seen at the Student Health Center, your bill will appear on your Mizzou student account.